Today's Lily's 12th birthday. I'm just happy I get to celebrate her for another year, even though it's a reminder of what's to come.
All across Florida, this is the story of children with severe disabilities and rare diseases.
He's probably like 1 in 63 in the world that we know of.
And a state government missing in action.
You have to be on the wait list.
And almost half of the people on the wait list have been on it for over a decade.
People are going into adulthood and still on the wait list.
It's a problem and a Fox 13 investigation more than 20 years in the making. I'm Craig Patrick, and I started covering the state backlog for home-based care in 2005. Through 4 governors, the crisis mounted.
Even with this large infusion of funds, the waitlist continues to grow, and APD reverts unused cash each year.
Now we'll show you how it's reaching a breaking point.
He broke his back in 5 places.
It makes me angry.
As thousands of families are waiting for help.
The money is there. Why not distribute it to us? We need it. But since we're going to the bed, this is what that looks like.
We met Natasha Clay a year ago, training to carry her daughter London around the house and begging the state for help.
Okay. Take a deep breath. Deep breath.
London's paralyzed and her brain did not fully develop. She's eligible for home-based services through the state, but has been stuck on a wait list since she was born.
I don't think I'm gonna make it.
After our interview,
This is too much.
Natasha had a stroke. She's thankfully recovering.
The biggest thing would have been nursing help. When you have a child that is total care.
We also met Deanie Sidney and her daughter Madison. She's blind, hearing impaired, and born with rare conditions that affect her brain, heart, and ability to move. Deanie quit her job to care for Madison while her husband Marvin bagged groceries to keep them going.
And one of his minimum wage paychecks from bagging groceries was $20 over the traditional Medicaid limit. And they cut us off.
And then Marvin died.
You got your bows in?
Medicaid reinstated, but Madison got stuck on the same wait list until Deanie exhausted herself and broke down.
You can't control a psychotic break.
For the past year, we've met one struggling family after another, all with children who have severe developmental disabilities, who all qualify for home health services, but wound up stuck in a government backlog.
And I'm just walking around Walmart and crying.
And nothing may drive home the problem more than Yasmina Halim and her little girl Lily.
Can you say your ABCs?
I can.
Yes.
No.
Please?
Okay.
Lily liked to dance and dress up like a princess, loved going to school and showing off from the start.
Now I know my ABC. Oh.
But as she grew, she started losing her balance. And tests revealed a rare and fatal disease called Tay-Sachs.
Our lives instantly shattered. Move this here so that she can shake properly.
Now she can no longer walk, talk, eat, or drink. And she wears this vibrating vest to help keep fluids from building up in her lungs.
She's not going to get to do everything all her little friends get to do, Yeah. Do you want to put this one on top now?
And when Yasmina quit her job to care for Lily and found out she qualifies for home-based support services, well, the state of Florida did at this point what you might expect for a terminally ill child. The state put her on a wait list.
For a terminally ill child.
The average wait has been around 8.5 years, and doctors say Lily has maybe 3 years more to live.
It's like my child doesn't matter. It's just a number.
Families are supposed to have a choice for loved ones with severe developmental disabilities. They can put them in an institution or receive nursing, therapy, respite, and other support services at home. And a lot of parents like Yasmina, Deanie, and Natasha choose the home-based option.
They deserve dignified lives, and they deserve their parents next to them.
And that home-based option is supposed to save taxpayers because it's a lot cheaper than what institutions charge per patient each year.
It was the difference between $100,000 a year to less than $60,000 a year.
And yet more than 21,000 people are on the wait list.
No, yeah.
Okay, you let me know?
Yeah.
Okay, thank you.
At risk of going into those far more expensive institutions that their families don't want.
At some point, you need some services to help you, and I'm doing the job of a lot of people.
Florida's APD, or Agency for Persons with Disabilities, manages the backlog and ties it to a lack of funds. And to that point, it would cost around $1.2 billion to get everyone off the wait list. But for context, the state has also received multi-billion-dollar windfalls for years. First under Governor Scott.
We have nearly $3 billion more revenues than projected expenses this year.
And then lawmakers piled up billions more in reserves under Governor DeSantis.
We're in great financial shape. We have surpluses. We have the ability to do what we need to do.
And if you're wondering why the legislature did not set aside more money to clear the backlog, it actually has. But APD did not spend it.
It's hundreds of millions of dollars, and it's basically from past year surplus that gets rolled over to the following year.
So as families suffered without services they're eligible to receive, and as the legislature instructed APD to reduce the wait list as much as possible, believe it or not, for the past 4 years, in terms of funds meant to reduce the backlog, APD sent more money back to the legislature than it received from the legislature.
$360 million is being recommended to revert and reappropriate this year, when we've appropriated an average of $88 million over the past 4 years to pull people off the wait list.
By that math, in the past 4 years, APD sent back around $8 million more than it received.
What was that ballpark number?
We have approximately $360 million.
$360 million unspent because APD says people they're already serving may have growing needs and they don't want to run out of money.
We don't want to overextend ourselves.
But Jim DeBogren is a former APD leader who told us they should not worry about that because the state projects what current enrollees will need and commits recurring funds for them.
That should be already in their base budget.
And that's just $360 million unspent in state dollars. If APD had spent it as the legislature intended, there would also have been more than $520 million in matching federal funds. In total, that's more than $881 million and counting. At the current rate, it could be more than $1 billion next year. Funds intended for therapy, nursing, and other services for some of Florida's most vulnerable citizens, as thousands continue to suffer and wait. Well, the state does give families a chance to get off the wait list if they're in crisis, but that can take months and does not always work. We'll show you why when we come back. This 10-year-old boy needs help. Bennett Olive was born with a rare gene disorder that delayed his development.
He ranges from 2 to 5 on the intellectual scale, depending what it is.
He had 6 surgeries and a shunt that runs from his brain and spine to his stomach to keep him alive.
It could fail at any time, so anyone that's around him has to kind of know the signs of a shunt failure.
He has intense seizures.
We would have at least 1 seizure a week.
Some have lasted for hours.
The ambulances had to come and start breathing for him with the ambu bag. His face was completely blue. He was on about a 3-hour seizure and he just still wasn't breathing, still wasn't coming out of it.
Well, he's pulled through time after time and makes his parents, Wes and Kelly, very proud. But he requires a lot of attention, which is why Kelly gave up her job to care for him.
We have to blend all his food for him and feed him. Diapering, all the things you would do as like a newborn mom, I still have to do with my 10-year-old.
How many you want to do?
He can have fun on a swing or a slide. In fact, that's his favorite thing to do, which is why Make-A-Wish built this playground in his backyard. But he qualifies for much more support through the state.
Hey, Ben, let's go up a slide.
Bennett and his family have Medicaid. And with Bennett's conditions, he's eligible for a range of home-based services for children with developmental disabilities. They just can't get it because Bennett's stuck on a wait list with more than 21,000 others.
And right now we've been on the wait list for 7 years with no idea when we could possibly get off.
A waitlist state managers tie to a lack of funds if you don't count the billions our state government stashed in reserves, or the hundreds of millions intended to reduce the backlog that they did not spend.
They talk about what a vulnerable population it is, what a sacred population it is, and then hold on to the monies.
And that's just part of the problem that causes families to suffer.
You have to be in like a dire, unsafe situation. And even then, you still might not get off the wait list.
Yeah. Do you want to put this one on top now?
The state will take you off the wait list if it determines there's a crisis. But we use that term loosely. For example, Yasmina Halim's daughter Lily has severe developmental disabilities and is terminally ill. Doctors give her around 3 years to live.
And even though we qualified for crisis, we were denied several times.
Meanwhile, Stephanie Norton's son fell out of a second-story window.
Broke his skull in 5 places. He broke his back in 5 places. His arms were sticking outside of his skin.
Thankfully, he healed. And the state did take him off the wait list. But guess how long it took to get the home-based services after the fall?
Logan waited 385 days to get services into the home.
Deanie Sidney also got her daughter Madison out of the backlog due to crisis, but only after her husband died and she overworked herself caring for Madison until she had a breakdown.
I signed myself into a mental hospital, inpatient.
Meaning it took a crisis to get the nursing care, equipment, and special assistance that could have prevented the crisis and saved taxpayers.
Think of how much money you would have saved because they had to pay for my inpatient stay, the aftercare from the inpatient stay, all the medication I take.
Which brings us back to the Olive family and Wes's drop in customers after Hurricane Helene and the mounting costs of Kelly's staying home for Bennett. They could not afford the mortgage payments, went into forbearance, and are now trying to avoid foreclosure.
Therein comes the crisis. If we don't keep our house, we might be homeless.
Which is the basis of her application for crisis, which in itself also illustrates a broader problem with our state government when you think and talk it through.
So the crisis would be losing your home, being out on the streets with Bennett.
That would obviously be a crisis, yeah.
And he would get home-based services then.
Yes.
But with no home.
Yeah, that's what how they have it programmed, yes.
Or they could get you off the wait list now,
yeah,
and you wouldn't lose your home.
Yes.
So you have to have a crisis in order to get what you need to have prevented the crisis in the first place.
Yes. And even then, they still might not accept your crisis.
Some lawmakers have tried to help. For example, they required the state to approve or deny a crisis claim within 15 days. But families say it's still taking months just to get an answer either way. The legislature also required the state to create an online application to speed things along. But the online application they created does not offer an option to claim a crisis, sending families like the Olives right back to pen and paper forms.
It's a tough pill to swallow.
The legislature also created a program for parents on Medicaid to go through training and get hired as caregivers for their kids. And that could be a lifeline for the Olive family if only the legislature thought that through.
And so if you take the paycheck, you get kicked off Medicaid.
That's right. For many parents, the program would pay them just enough to disqualify them from the same program that would pay them and cut off their medical insurance to boot.
So it's like a catch-22. You're going to go through all the training, you're going to get one paycheck, and then you don't have Medicaid anymore. It doesn't even make sense.
Which leaves parents with an unthinkable choice. Continue to wait for home-based services until you go broke and lose your home, or send their children to an institution that would cause taxpayers more and break their hearts.
I just could never imagine that I would have to put my child in an institution just so I could get a job to pay the bills. I got you.
But after 3 years of waiting and struggling, Yasmina finally made that unthinkable choice.
We were going to wind up with having to put her in an institution. And I could never imagine how I could sleep at night without my child next to me.
Which does bring us to one more twist that highlights yet another problem. With the shortage of providers and the scale of Lily's needs and the complexity of her disease, they could not find an institution that would accept her. The state then granted her application for crisis and approved the cheaper option of providing services to their home.
You like the weather today, Lily? Is it pretty out? It's a good day today, huh?
So it finally delivered some favorable results for Yasmina, but further revealed how dysfunctional the situation can be. Coming up, a closer look at the problems and the search for solutions.
If you're a state lawmaker and you know more than 21,000 people with developmental disabilities are stuck on the state's wait list for care and have been for years, and you claim it's due to a lack of money, what would you say to this?
When Governor DeSantis said you have so much money, y'all don't know what to do with it. In fact, listen to him for yourself.
We've got a big budget surplus. I don't need the money. You guys save your money. I don't know what to do with all this money. A surplus is so big.
Sir, this is a problem.
Thank you for listening to me.
This is JJ Holmes, and that was not the first time state lawmakers tried to cut him off. For the past year, we've followed JJ from his home in Seminole County to the Florida Capitol, to legislative meetings through the Tampa Bay area and all across the state.
Okay, Miss Ellison, we have 3 minutes for JJ.
In this meeting, he thanked the state's Agency for Persons with Disabilities for finally getting him service after 18 years of waiting.
But let's be real, that's not exactly something to celebrate.
I mean, it's devastating to know that 18 years that he's wasted and that money was just sitting there unspent.
At this point, you can probably guess what happened before JJ's 3 minutes were up.
Allison.
Because in May, Governor DeSantis said, and I quote,
"Thank you,
You've
JJ.
got a big budget, sir."
JJ Holmes knows how to get state lawmakers' attention and push their buttons. And they've said that's exactly what they need.
Thank you very much, JJ.
In 2024, after we aired JJ's story and followed him through the halls of power that year.
Nice to meet you, Leader Driscoll.
You are amazing.
The legislature responded.
And so this is not me who put this bill on the agenda. It was JJ.
They passed a bill committing more than $38 million to get JJ and around 300 others off the wait list.
It is totally about time we really make sure we're taking care of our most vulnerable.
But again, that helped around 300 out of more than 21,000 waiting, which is why JJ is still pushing.
What grade would you give our state government today?
Unfortunately, Craig, I'd give them a 0. If I was a teacher and the state legislature was my student, I'd have to sit down with their parents and have a conversation about repeating a year.
But the Senate president who credited JJ for their work in 2024 is gone, along with some others. And that may be part of the long-running problem. In a part-time, term-limited, revolving-door legislature, new members always have to get caught up to speed. And the same goes for the Agency for Persons with Disabilities.
I mean, the turnover is great. I think that that has a lot to do with those funds not being expended. You've had 4 secretaries in 4 years.
Make that 5 in 5 years.
When will you be able to spend down the hundreds of millions in surplus you already have?
APD Secretary Taylor Hatch resigned after our interview, and an interim director took over.
You get somebody who comes in and they're trying to figure things out. By the time they figure half of it out, they leave and somebody new comes in.
JJ and others say prior legislatures also tried to downplay the backlog. A couple of years ago, they actually passed a law to replace the words wait list in statute and records with the term pre-enrollment, which now leads to a number of moments like this.
The wait list continues to hover around, the pre-enrollment list continues to hover around 22,000.
Even APD can't help but call it for what it is.
Roughly around 22,000 at any given time on the pre-enrollment list.
It's not pre-enrollment. It is a wait list.
Well, the current legislative leaders do call it a wait list. And they are taking steps to try to clear the backlog. But JJ fears one of their biggest moves could backfire.
I'm scared, and I don't understand why they're doing it.
The state opened a voluntary pilot program for home-based services in parts of the state. Families can give up their spot on the wait list and get support through a private managed care plan instead of waiting to get it directly from the state. And lawmakers have interest in expanding it to everyone on the wait list, whether they want it or not.
It looks great that you've got all these benefits, but when you actually try and use them, then you just hit a brick wall. You slam into a brick wall.
Allison is referring to their experience with private managed care through Medicaid for medical benefits. They're not happy with how it tends to JJ when he's sick. So the idea of extending it to his daily living needs concerns the Holmes and others who need similar help.
The health insurance private sector is really not set up for long-term care. It's set up, you're sick, we get you healthier, you're good to go.
For the past year, Allison tracked how JJ's medical appointments turned out with Medicaid's managed care system.
34 rides didn't show up.
Out of how many?
Out of 40, the last 40. And then they'd say, we've resolved your complaint, resolved your grievance. We'd get a letter, and the same thing would happen next time.
JJ continues to travel across Florida to discuss this with state lawmakers. He said he also has questions for Governor DeSantis, but can't get through to him. So we closed our interview by asking him what exactly he'd like to ask the governor, and said we'd pass it along.
Why do you go around the state bragging about how much money you have in the surplus while there's a massive wait list? Would you have your kids on managed care if they have complex medical needs, which 34 out of 40 rides don't show up? Please let me ask you some of these questions and more. I'm sure Craig Patchwork would love to cover our conversation. Thank you.
We emailed JJ's questions to Governor DeSantis and have not yet received a response. We have much more on the wait list and the toll that it's taking on the Fox Local app. Thank you for watching. We'll continue to investigate as families continue to wait.